Hey, Derek, and all the panelists, what a fantastic conversation you just led with that group, and brought out a lot of really amazing things that we've heard throughout the day. I mean, this has been a really extraordinary day of real deep consideration. Derek, I think you'll probably recall when we were doing some of the planning on this, that one of the things we talked about is how COVID, in a way, was almost an opportunity for us to kind of have our medical version of the Big Bang, right? That a new diagnosis being born and kind of watching that happen. I mean, we're living in a time where I guess we've just launched a giant telescope into space to try to look back at our entire history of our universe. We're living here on Earth and seeing the Big Bang of a new diagnosis. And I guess what I've heard here today confirms some of what we've all experienced, that the Big Bang is messy. I guess something maybe different than the universe is if the Big Bang, if a new diagnosis happens in a inequitable system to start off with, it's going to kind of assume that shape in some ways. And I think that's the sad reality of what we've seen to some extent with what has gone on with COVID. And we certainly heard a lot about that today. But, it's interesting as I reflect on this, and I'd be interested in your thoughts, Derek, but as I reflect on this as compared to the workshops that we've done on sepsis, cardiovascular disease, cancer, this one more than any of them, and for, I guess, the obvious reasons, really highlighted the role of public health in advancing and the role of government investment in advancing diagnosis. And I say that because some of what I take away is that I think we heard today that industry inventors, they're ready and willing to pursue a strategy of direct to consumer, direct to patients technology in the name of patient-centered care. But I don't think that in and of itself is sufficient for patient-centered care. That's what we just had. Your panelists just talked a lot about that. The individuals who are going to use that need to be prepared with knowledge so they can match and understand the potential use of that technology, align it with their values, and to make decisions about their health. And I think we would be mistaken if we just sort of assume that if we create the technology, it'll be sufficiently self-assembling that it can just be used perfectly. I think we need to think more about it. I think what we just discussed is, where's that help going to come from to support this transformation to the extent it's underway to move diagnosis to a more patient-centered activity? I think we've heard that the medical profession is, not quite ready to give up control, and our governments haven't invested maybe sufficiently in figuring out its role in supporting individuals to be able to make use of these technologies in the most intelligent way. So I guess one of the takeaways for me that is different from the other conditions is that substantial consideration needs to go into how the public investment can support what is happening on the technologic side to really drive more patient-centered diagnosis, if you will, in this condition. So anyway, those are a couple of the reflections I had. I'd be interested to hear what you had to say, Derek.
Yeah, I think that's all totally right. I think there were a couple of words you said that made other words come in my head. When you said patient-centered, I couldn't help thinking that one of the big things about COVID is that it's made everyone think about COVID even before they have it, i.e. when they're not patients, when they're people. And I think a huge part of diagnosis, unlike, I mean, Stephen made his comments about working on chronic disease management, but a big thing about diagnosis, it's very tied to the front end and to prevention and to strategies to avoid getting sick in the first place. And I think COVID has been a beginning window on what happens when the whole planet thinks personally about a disease from their perspective even before they have it. And how can we harness that intellectual engagement? And I think that feels like that's the way we transition to thinking about in non-communicable disease as well. I think some of Nicole Alexander Scott's these demonstration projects in Rhode Island just left me incredibly excited as learning units. And I also thought about Nicole as the modern public health officer. And we think in the United States about public health as something we did in the 19th century. And it ended when we put clean water into the system. And clean water was done by engineers. And it was done by a small band of professionals. But 21st century public health is going to be done by the public. It's going to be done by us. And I think the real challenge is for those of us who are paid to be healthcare professionals to really work out how we're partnering with the public in this endeavor. It's not direct to consumer. It's almost, or direct to patient. It's sort of consumer demanded. It's consumer engaged. Even the phrases we have use the wrong words. The preposition isn't to. We're not going direct to the consumer. And so I think we could be. I'm going to end optimistically, but I think COVID could be seen as a little, as you said, we got to see in a sped up way. With a supercharged disease that made everyone think about it over a very short time frame, how the whole world got engaged. And now we need to think about, for all sorts of other chronic diseases, how we engage people long before they might ever become patients in best strategies to prevent, mitigate disease, or should they get something to self-diagnose as early as possible. And I look forward to that being managed by our 21st century public health force. We've just launched a space force. I look forward to the new public health force. We've got to strongly fund people like Nicole to build these sort of organizational units across the country and do it as a joint American or global endeavor.
Sounds great. Well, listen, it's been a real pleasure co-chairing this with you, Derek. I think we have a lot of people to thank, including all the fantastic panelists today. And of course, the outstanding staff at the National Academy of Medicine who produced this program flawlessly and virtually for us all today. So with that, I think it's probably time to sign off and just thank everyone. And as we've done with the other workshops, there will be a synopsis developed of this that will be forthcoming at a later date. But what a pleasure to be a part of this and to learn with all of you. And thanks for your partnership on this too, Derek.
You're most welcome. Thank you, Andy. And I agree. Thank you to the staff and to the Gordon Betsy Moore Foundation for pushing us on all of these ideas.
Terrific. Well, thank you all and goodbye. Have a great rest of your day.